Hello, my name is Carl Wierks. I'm a board-certified, fellowship-trained orthopedic surgeon practicing at West Michigan Orthopedics in Grand Rapids, Michigan. This is a brief overview video to describe FAI. FAI is an acronym for femoro-acetabular impingement. Our hip joints are a ball and socket type joint, and FAI refers to a shape mismatch between the edge of the hip socket and the neck of the femur. This shape mismatch can occur as a result of extra bone growth in either of these areas and often develops during adolescence. FAI is broken down into two types, CAM and pincer. CAM type FAI refers to a bony bump or lack of contour on the femoral neck junction. This is the area where the ball of the joint starts to taper down into the neck. If instead the growth plate at that location lays down additional bone, then it creates a bump instead of a valley. That bump is called a CAM because it is out of round. The CAM can then hit up against the edge of the hip socket where the cartilage labrum lives and cause a labral tear. While the CAM itself does not cause pain, the labral tear can be very painful and subsequently limiting if not treated. In addition, evidence suggests that large CAM deformities are a cause of early hip arthritis, and that reshaping the bony bump may delay the development or progression of the arthritis. Pincer type FAI refers to extra bone coverage on the socket of the joint. This can be a result of a socket being too deep with subsequent global overcoverage, or from the socket being rotated toward the back of the hip, resulting in more focal impingement in the front of the hip. The labrum can be traumatized and potentially torn due to being crushed between the edge of the socket and the overhanging neck of the femur. CAM and pincer types of FAI can occur in isolation, but often there's a combination of both. This scenario creates a particularly high risk of developing a labral tear. Diagnosis of FAI includes a history and physical exam by a medical professional familiar with the diagnosis, X-rays to evaluate the bony aspect of the hip, and then often an MRI to evaluate the cartilage and other soft tissues around the hip. Initial treatments include rest, anti-inflammatory medications such as ibuprofen, and physical therapy. If symptoms persist for at least 3 months despite these conservative treatments, then most cases of FAI can be treated through an arthroscopic or minimally invasive surgery. If you think you may have FAI due to hip pain or limited hip range of motion, a good place to start is with your primary care physician, physical therapist, or sports medicine surgeon like myself, who is familiar with the diagnosis and treatment.